Hello, everybody. Good evening. I'm about to go ahead and get started. Let me just see who we have watching. You go back and read some of these comments. Hey, Susan, Life of Male, welcome. She's watching from Louisiana. Welcome, Life of Male. Gabby, hey, Gabby. Okay, she says so. She's an MA tonight. It's her last class. All right, Gabby, you made it to the end. Congratulations. Just Courtney, hey, Courtney, watching from Ohio. Hey, Jasmine. Stephanie, hey Stephanie, I hope you had a good day too, a great day too. Life Mail said I graduated, just have to take my certification. It's hard to find a job as a new MA. That is true. I do have a video on the channel, Life Mail, if you haven't seen it already, that I give advice on the what I believe are the top three ways of finding a job as a new MA. Check that out if you haven't already. Watching from Columbus, Ohio, Brown Eyes. Hey, Rebecca. Jen, oh, congratulations, Jen. She passed her CMA in April, CMAA. Courtney is currently a student. Hey, Stephanie from Florida. I've seen you before. Hey, Mariana. Yeah, she passed hers 2 days ago. I will be shouting you out in a moment, Mariana. Golden Nightmare. Hey, Lip Balm Queen. She just finished externship and getting ready for the CMA exam. All right. Susan is from Los Angeles, California. Hey, Drakita from West Palm Beach, studying for CMA. All right. Indy is watching from Grand Rapids, Michigan. Okay, Gabby. Okay, got you. Okay, shoot. So not a student. I did not. Oh, okay, got you. Brown eyes. If you didn't pass your exam, would always tell people to just pay attention to those areas where you fell short and just make sure you hone in um, on those areas. I'm going to be doing a video soon on that because I've had quite a few people and even some of my students, they don't pass on the first time and they have to take it again. So I think I'm going to do a video talking about that. Go to Nightmares from Vegas. Hey, Mila. Okay. From Maryland, a student. Okay, Mila, you're near me. I'm in DC. Susan, first time. Okay, Susan, I'm glad to have you here. August 30th for CMAA. Okay. Hey, Stacy. Latoya taking exam. Ooh, which exam are you taking on Tuesday, Latoya? She's watching from the Bronx. Okay, New York in the house. Okay. Stacy watching from Washington State. Okay, Stacy, I'm in Washington, D.C. All right, so let's go ahead and get started, guys. I'm tired tonight. I had a very long day. And for a moment, I started to reschedule to tomorrow, but Fridays are bad, and I know a lot of people are not available on Fridays anyway. So I'm gonna push through this. We're gonna get through it. I'm not going to be an hour and a half like we were last week, but we're going to get through these questions. Okay. Tracy's watching from Missouri. Hey, Veronica, my regular. April. She's from Washington. Oh, I'm sorry, watching from Waterloo, New York. Okay, she's taking her CMA on September 7th. Okay, CMAA. Ash is from California. All right, ladies, mostly ladies on here, and gentlemen, just in case I missed any of you all. So let's go ahead and get started here. Let me go ahead and go to this next slide. I want to shout out some people. So Dolly, I definitely want to shout out Dolly. Dolly is one of the people that I've recently had a one-on-one. I'll talk a little bit more about that at the end, but I just started offering one-on-one sessions, and we got on last Friday. What was that? Friday. Yeah, she took her CCMA on Sunday, and she passed with a 429. So congratulations to Dolly. I'm not sure if she's watching. Presidents of America is a high school student who has passed the CCMA. Congratulations to you for starting so early. Mariana is currently watching right now, so let's give Mariana congratulations. She passed. I screenshotted this, I think yesterday. So this was a couple days ago. She took her CCMA. Congratulations, Rebecca. Congratulations, yes, Marie. Congratulations, Lisa. I think I saw Lisa log in here. Hey, Lisa. She passed. Congratulations, Andrea, Samantha, Jacqueline. She just messaged me early. I was able to add this like just a little while ago. She just messaged me. Congratulations, Jacqueline. Lovely Lioness and Elisa. Latrice, congratulations. The love of Shay. I want to definitely shout out this person right here, Patricia, because she has the highest score I've ever seen. A perfect score is 500. And I had one of you all on here was at a 476, and at that point that was the highest I've ever heard of. But this 481 is actually the highest now. So, Patricia, if you're watching, you have broken the record. You are at 481, the highest score that I have heard of in my years. So you are very close to that perfect score of 500. So I definitely wanted to shout you out. Congratulations to everyone. So for those of you who've passed, make sure you let me know in the actual comments. When you let me know in the live chat, I'm not able, well, I can screenshot it, but I won't be it just wouldn't look right. So I prefer you to put it in the actual comments. So if you're on here and you pass, make sure you put it in the comments of either this video or one of my past videos, so that way I can shout you out as well. Okay, so I'm just looking at the chat really quickly. Everybody's pretty much saying congratulations. I see Veronica saying congratulations. Let's see. Okay, so India says she's working at Spectrum Health. Okay, I've heard of Spectrum. Watching from Texas. Hey, Joanna, Yannette. Okay, Yannette. Yannette is another one of my regulars. Happy to join again. Okay, thank you, Johanna. All righty. So, few tips before we begin. Same as always, you guys know the routine. For those of you who are regulars here, you know how we do. You can screenshot these tips if you like, but definitely you want to make sure your life is revolving around the study materials. I always like to go through these just in case it's somebody's first time watching. Some of my videos people come across on Facebook for the first time. And so, for those of you that always join me, I know this is repetitive, but anyway, we want to get through it. So let your life revolve around the study materials. Join medical assistant groups on Facebook and network. Find out who else is, has passed the test. What do they do? What tips do they have for you? Do they have study questions for you, right? Pay close attention to wrong answers on a practice test. We'll talk about that as we're going through it. Do not focus more on the questions than you do on the actual contents. Don't try to memorize these practice test questions. Create flashcards and have a family member or friend quiz you, especially for those people who maybe have failed before, those areas where you've fallen short. Have somebody quiz you in those areas. Pay close attention to each question and recognize keywords. I'll point that out as we're going through it. Use process of elimination when you need to. Big one, at this last one is a very big one. Answer your easy questions first and flag the difficult questions to come back to later when you guys are taking a test. You don't have to run through the test in order. Any question that you feel like is difficult, flag it. Get through your easy questions first. That 3 hours that they give you to take your test, it goes by really quickly. Okay. Let's see. Okay, Vampy says, Miss Cat had my diploma that says medical assistant and doing administrative exam is in August. Can later on do the medical. Oh, you're asking, can you do the medical certification? So, okay, so your diploma says medical assistant and you're doing administrative exam in August. Oh, yeah. Do you mean, can you do the clinical certification later? Yes, you can. So if you're a medical assistant, you graduated from a medical assistant program. Yes, you can take the. I'm guessing you mean clinical certification. Yes, you can. All right, let's get started. Which of the following should sign as a witness after the physician signs a patient's advance directives? Attorney, healthcare employee, a non-affiliated individual, or a family member? Which of the following should sign as a witness after the physician signs a patient's advance directive? Now, what is an advance directive? So, pay attention to information that's on the test, right? On these practice questions. And that's what I mean by paying attention to wrong answers and not trying to memorize the question. Because if you try to screenshot this question and think that, oh, this question, oh, then you take the test, oh, I didn't see this questions. I didn't see none of these questions. That's where you go wrong. I was just explaining that to somebody yesterday. Who said I didn't see any questions. I say the same thing over and over. Do not look for the actual questions. Pay attention to the information, okay? Um, advanced directive. What is that? Advanced directive, that is the legal document that states decisions that a patient once made once, if they become unable to do so, right? Let me see. For some reason I'm not seeing these. Okay, now I'm seeing options coming up. And so when a patient fills that out, they have to have a witness. Now, which of the following can be a witness for that patient? Okay, Vampy says yes, clinical. I don't know if it's just slow on my end or if people aren't commenting, because for some reason I'm not seeing anything come up on my end. Let me know. Somebody type really quickly. I just want to see what kind of delay I have over here because normally I'm seeing normally comments come up quicker than this. So for some reason I can't see. So let me know. Somebody comment I can hear you. Oh, Veronica said it is slow. Oh my goodness. Yeah, it is very slow. Thank you, Veronica. All righty. So, C, if you say non affiliated individual, so who can be a witness? A witness can only be somebody who does not have any interest in the outcome. It cannot be the attorney because the attorney may have an interest in the outcome, right? Because if the person passes away, that attorney may be entitled to some money. Okay, so can't be a family member either because they may benefit from it. It can't be anybody who has an interest. The healthcare employee, it can't be the healthcare employee either. It can't be the physician. Well, the physician he signs as a physician, but as far as a witness, it has to be a non-affiliated individual. Which of the following actions should an MOA take when answering the telephone? Answer telephone calls by the third ring, assist callers before assisting patients in the office, use the speakerphone when multitasking, or turn on the answering service when there is a high call volume. And when I say MOA, that just means medical office assistant, okay? So you all should know that MOA, I just mean a medical office assistant, okay? CMAA, also known as a CMAA, Certified Medical Administrative Assistant. So you'll see me use that quite often, MOA. Yes, know your abbreviations. Thank you, Mariana. Feel free to add any more tips. Mariana, Veronica is pretty good with adding tips here. Let's see. Somebody I see you said great advice, Rebecca. Oh, Rebecca said I passed my exam on Monday and the questions are worded. Yes, definitely know your content, not the questions. Anybody else who have passed, definitely feel free to add your advice. Thank you all. Definitely do not try to memorize these questions. And yes, know your abbreviations. I'm going to be doing a video soon where I'm going to be highlighting terminology, abbreviations, things that you absolutely need to know for these tests. I mean, it's broad, so it could be any of them. But what I noticed the most on these tests, I'm going to do a video. Nisa said, "What is third ring?" I love it. Jeopardy. She said, "What is third ring?" Oh, she's asking. I'm sorry, Nisa. For a second, I thought you were answering. So third ring means ringing three times by the third ring. That's what it means. I'm sorry, Nisa. The third ring means that the by the time the phone rings three times. So if you chose that answer, you are correct. So why though? You don't want the phone to ring too long in the doctor's office. See, questions like this is one of those instances where we could look at these other answers and eliminate those, right? Because use speakerphone when multitasking. We should never use speakerphone when speaking to patients, especially when there are other patients around. Now, if you're in the office by yourself, nobody else is around you on speakerphone, that's one thing. But when patients are around, you don't, and you're talking to a patient on the phone, you should not use speakerphone anyway. Turn on the answering service when there is a high call volume. Absolutely not. The answering service is for when you close the office for the day. Okay. Assist callers before assisting patients in the office. We rule that out because we want to assist the people in front of us first. Okay. Now I'm going to give you an exception. Okay. So again, B is wrong because you want to assist the people in the office first. Okay. But the exception is if you are already on the phone with someone and then somebody walks in, okay? You do want to continue that conversation that conversation that you're having over the phone, and you acknowledge to the patient in front of you that you'll be right with them. You can nod or put your just let them know, mouth, that I'll be right with you. Acknowledge the patient, okay? And hint, that is a question that you may see on a test. Okay, I'll just repeat that one more time. B is wrong because you do not want to assist callers before assisting patients in the office. Patients in the office come first, right? However, the exception is if you are already on the phone. Finish that call, acknowledge the patient's presence in front of you, and let them know you'll be right with them, okay? And why do we want to answer the phone by the third ring? because we don't want the phone to ring too long. Now, would there be instances where maybe you are absolutely, just too busy, maybe you is short staff or whatever, and it may happen? Yes, there are times that may happen. However, best practice is to not let it ring no more than 3 times. You want to get the call by the third ring, okay? Let me just see. I hope that made sense. Go to Nightmare. See, Go to Nightmare says, I'm curious as to why. Hey, did that help you, Go to Nightmare? It's always been best practices not to have the phone ringing too long, and really it's medical field, but really, in any professional setting, they will tell you never let the phone ring more than 3 times. Let's see. Let me make sure I'm not missing anything else. Okay, good, Nisa. Okay. HIPAA, yes, HIPAA. And I will tell you this, Go to Nightmare. Make sure you know that HIPAA is HIPAA, and don't feel bad because a lot of people they abbreviate HIPAA HIPPA, but HIPAA is HIPAA. Okay. Now, why is that so important to know? First of all, you need to know your acronyms, right? And then second of all, HIPAA has two um provisions, right? And that is the portability and the accountability, right? Now, if we spell HIPAA HIPPA, where is the abbreviation for portability and accountability act, right? So you got to remember that. Remember what HIPAA stands for. Health information. I'm sorry, yeah, health insurance, portability. Oh my goodness. Yeah, portability. Sorry guys, I can't talk tonight. I told y'all I'm tired. Portability and Accountability Act, okay? And the two provisions of HIPAA is the portability, right, that allows patients to be able to take their insurance with them if they move employers or whatever. And then accountability, that provision of HIPAA holds us as medical professionals accountable for keeping patient information private, right? Make sure you know that. You may see that on the test about the two provisions, okay? Yes, okay. Every bit of I'm just going through this. She's taking a CPT exam. Okay, okay. I'm glad. Okay, got you. Go to Nightmare. Okay, glad that's helping. That's exactly why we do these sessions. I'm so glad that helped. Okay, Andre. Okay, three. Oh, okay. Andre says he scored a 3. Okay, Andre, it's okay. You know what? I know. I know you're upset, but it happens. Trust me, it's very common for people to not pass the first time. But the thing is, you want to make sure you learn from that, and you want to hone in on those areas where you fell short. What areas are you falling short? I see you say you forgot some of the medical term. So that means that you want to make sure you are studying medical terminology, right? Making sure you guys know those body parts when you see them, the organs, right? Making sure you can recognize those suffixes, especially those common ones, ectomy, otomy, ostomy, and things like that, right? Making sure you recognize those common prefixes, hyper, hypo, peri, epi, and things like that. I'm going to do a video on that. AMA, which I'm not sure if it's different from, but I got a 409. So AAMA is that's CMA. Was that a passing score? I can't remember what the high score is for. I think is it 800 for CMA? I forgot. I got a video on it talking about it, but I can't remember. So let me know, Artemisa. Mariana says she's sorry. Don't get discouraged. Yes, keep trying. You'll pass it. What if you are with someone but the phone rings? Oh, that's a good question, Yanette. Yanette says, what if you're with someone but the phone rings? So you can just thank you for calling YouTube Family Practice. This is Yanette. How may I direct your call? When they, if they need to be transferred, you're going to transfer them. When they say, hey, can I make an appointment? Just let them know, hi, I'm sorry, I have a patient in front of me. Can you hold on for one moment? So you can answer and then just let them know that you have to place them on hold. The worst thing is to YouTube Family Medicine, hold please, and then just put them on hold. Because some people, all they need is the address. They just trying to get there. Some people, they just need to be transferred. They need the fax number. So you can answer, let the patient in front of you. Hold on one moment while I place this call on hold. Pick the phone up, place the call on hold, and then, continue with the patient in front of you. That was a good question. Okay, chain of custody. Thank you, Mariana. Yeah, she says she had a lot of chain of custody questions. Make sure you know that in case you have a test with chain of custody questions. Thank you. And this is a good time to reiterate the fact that every test is different. So one person may have a lot of medical terminology on their test. Another person may have a lot of, like Mariana said, custody chain of custody questions. Okay, um, so yeah, good tips in the comments. Make sure y'all are taking screenshots of some of these tips that the ladies and gentlemen are leaving in the comments. All right, let's keep going. I'll come back to the comments in just a little bit. Let's keep it moving. All right, which of the following tests would a provider order for a patient experiencing arrhythmia? Again, in my tips, I said make sure you pay attention to wrong answers. What do I mean by that? That means that once we figure out what this correct answer is, make sure you also know what those wrong answers stand for as well, just in case you see it. This is an example of studying the content and not memorizing the question. When you study the content, that means that every time um you got your correct answer, that means that you are also making sure you know what those other answers mean as well, just in case you see those in a question, because if it's an option, most likely it's probably going to be on a test. Okay, so it looks like everybody's choosing EKG. Let's see. That is correct. And arrhythmia, and if you know what an arrhythmia is, you know that that's an abnormal heart rhythm, right? And so EKG, exactly, electrocardiogram. And now what is an EEG? If you don't know that, this is the time to write that down. It's an electroencephalogram, right? That measures the electrical impulses in the brain, right? What is it? ABG, that's arterial blood gas. If you didn't know that, make sure you write that down just in case you see that question. It measures oxygen in the blood, okay? Arterial blood gas. What is GFR? Glomerular filtration rate, okay? That's a kidney function test. It tests the fluid in the kidneys, okay? So make sure you know what the wrong answers are as well as you are going through these practice tests. Now, what practice tests am I talking about? The practice tests that either the school provides for you or the practice tests that you go and purchase yourself. So if you're taking an RMA, you will go to AMT's website, American Medical Technologists, and get those practice tests if your school isn't already buying it for you. If you are CMA, you'll go to the AAMA's website and get those practice tests and study guides. If you're CCMA or CMAA, you'll go to NHA and get those practice tests, okay? All right, let's go to the next question. All right, which of the following will help minimize collection accounts? Establish a good patient relationship, continually update the fee schedule, maintain current patient information, or manually post journal entries. Minimize collection accounts. What are collection accounts? Think about what collection accounts are, right? What are collection accounts? Those are accounts by patients who did not pay their bills. That means that these are the accounts in which patients have gone to collections because they didn't pay their bill. Certain time passed, and now their accounts have been sent off to collections. What's the best way to minimize that? Look at each option. Now, if you were taking the actual test right now, and this is something that you need to think about, this is a good question to flag and come back to later. And you want to go through the questions that's easy for you. That way, you can spend the last half of your 3 hours, taking your time and working through questions like this that you maybe have to think about, right? All right, let's see. All right, so if you chose C, you're correct. Maintain current patient information. Let's talk about this, right? Help minimize collection accounts. What's the best way to help minimize collection accounts, right? First of all, we want to make sure we're collecting payments when the patient is in the office. The best way to collect payments, and that's actually a test question as well. Like it'll ask you, um, what is the best way to make sure a payment is made by a patient? It is when the patient is in the office, not by phone, not by mail. It's harder once that patient leaves the office. Okay. So first of all, we want to try to get those payments while the patient is in the office, right? Now let's say we didn't. Now we got to call the patient or send the patient a letter. We have to make sure that information is correct. So, out of all of these options, that is the correct answer. Because why? Because establishing a good patient relationship, that doesn't minimize collection accounts. We can have a good patient relationship and the patient not pay their bills, right? Continually update the fee schedule. What's a fee schedule? And you need to know this for these tests. A fee schedule, that is the list of fees, list of fees for the services that the provider charges, right? Um, and then the manually post journal entries. I'm sorry, that doesn't minimize collection accounts, but maintaining current patient information does, because if the patient didn't pay in the office, then we need to be able to call that patient. We need the correct phone number and we need the correct um, address and email, even, right? So this is why we verbally verify patient every time they come in. They don't have to fill out a form, but every time a patient comes in, phone number still the same, address still the same, right? They could have come last week and moved. They could have been here last Monday and then moved that Friday. So you always want to maintain current patient information by verifying it, okay? Which of the following can be signed by an MOA? Remember, MOA is medical office assistant. A medical report to an insurance company, referral letter to another provider, a letter to a patient about a scheduling change, a letter to a patient containing medical advice. While you guys are doing that, let me go back and look at some of these. Ruby Manning, congratulations. She said she passed 3 weeks ago. Congratulations. Brown Eyes said her test had a lot of administrative questions and CPT codes. Oh, see, every test is different. Administrative questions. Make sure you understand the difference between those CPT codes and diagnosis codes. Veronica said, I understood if you skip a question, they follow with more questions in a category. I don't know, Veronica. I've never heard that. Oh, I'm sorry. Okay, Artemisia. So this is what I would say if you failed the CMA. I would reach out to your school, and this is what I tell everybody who um, maybe still having a hard time passing the test. The first thing you always want to do is reach out to your school to see if they can help you. The school that I previously worked at, they had study sessions for students who had a hard time passing the test, because to be honest with you guys, it's always in the school's best interest for you to pass, because the passing rates reflects positively on the school. So they want you to pass, okay? Unless you have a school, I don't know, that passing rates and things like that doesn't matter, but for the most part schools are rewarded, or not necessarily rewarded, but it helps in it's a positive impact every time a student passes. So they definitely want you to pass, okay? So I will go to them, see how they can help, and then for some reason if they are not able to, then you may have to if you don't already, I would definitely get the study guides and the practice tests. Okay. And CCT is a national for CMA. NCCT, I don't know if NCCT offers CMA, but I know AAMA does. Um, and I do know you have to wait a year if you fail it a third time. So I would see what the school can do first of all, and then also another thing too. Honestly, Artemisa, you can also try to go for your CCMA as well. Like, and anybody here, let's say you maybe you tested for the CMA maybe 3 times, or maybe you tested for the RMA. Go for your CCMA. The CCMA, if you're a clinical medical assistant, the CCMA is a clinical certification, so that may be easier for you. So maybe you can go, like I said, try the school first, study guide and practice tests, right? And then if all else fails, just go to nhanow.com and apply to take the CCMA. And then you may have a better chance of passing that one, because I will tell you guys the RMA and CMA, they do tend to be more difficult because it's broader. Okay. They are broader. There's more questions on their tests, okay, on those tests. So that's always an option too. I hope I'm saying your name right. CCMA is certified. I see Golden Nightmare answer for this. It's certified clinical medical assistant. All of my videos are geared toward that test, the CCMA, and they're geared toward either the CCMA or the CMAA. Okay, those are the tests that my videos focus on. My teacher said I may need to find another. If you finish the program, okay, Artezima. Okay, I'm a certified. Okay, so Artezima, when you say you're certified medical assistant, are you saying you finished the program, right? But you just didn't pass the test. That's what I'm guessing. So in that case, apply to take the and let me put the website here. Uh, Somebody do me a favor that doesn't mind if they can type in the NHA Now website, www.nhanow.com. If somebody can put that in the comments, please, for Artezima. And then Artezima, if you want to do a one-on-one, I'll talk a little bit more about that in the end, but I just started on one-on-one sessions. You can schedule that with me. I'll leave the link as well, because I don't know, it seems like, okay, yes, I got a certificate. Got you. Yes, so you're a medical assistant. You don't need to find another MA program. You just need to take a different test. So that's what you need. You finished. There's no need to find another program. You just need another test. All right, so let's see. Sorry, guys. Let me get through this and then I'll go back and answer questions. I'm sorry. A letter to a patient about a scheduling change. Yes. So if you said C, that is correct. Medical reports, referrals, and letters to patients contain medical advice that is all outside of our scope. Okay. But we can send a letter to a patient about a scheduling change. All right, guys, let me get through this because I told you I'm tired tonight. So let's get through this and I'll get to questions later. Which of the following is used to submit claims for hospital services and procedures? Is it the HCFA 1500, HCFA 1450, UB04, or UB92? Okay, brown eyes. Okay, I see your comment. So I'll once we get through this, I'm gonna go ahead and address that for you guys. All right, let's see. Yep. So if you chose C, you are correct. UB04 is a claim form for hospitals and inpatients, right? 1500 is the universal claim form. Okay. Well, actually, HCFA 1500, that's actually an older version of the CMS 1500. Okay. The 1450, that's an older version of the UB04. Okay. And then what's that? UB92, that's an older version as well of the UB04. Okay. Oh, Golden Nightmare says, I don't think I've gone through this. Okay. Yeah. So, Golden Nightmare, this is the administrative test. Now, some of these, there are some administrative questions on the CCMA, but they don't go this in depth. And that's probably why you haven't seen a lot of this material. Which of the following describes double booking? I'll let you guys read that and decide. Double booking. But you do go to Nightmare. You do have to know, see stuff like this, the scheduling. You do have to know information like this for both the CCMA and the CMAA. Even if you guys are taking the RMA or the CMA, you do need to be able to answer scheduling questions. So, which of the following describes double booking? Okay, good. Go to Nightmare. I see you changed your answer. All right, A. Yeah, scheduling three patients at the same time. So double booking means that there's more than one patient at the same time for the same provider, right? Scheduling patients at regular intervals within an hour, no. Scheduling patients at a specific time based on the type of examination, no. Scheduling patients to arrive within the first 30 minutes, nope, nope, nope. But double booking is scheduling several patients at the same time. Which of the following actions should an MOA take when scheduling a new patient appointment? Instruct the patient to verify his insurance, verify the patient understands the co-insurance responsibilities, Explain the importance of fasting for 12 hours in the event the provider prescribes a blood draw, or inform the patient of the appointment cancellation policy. You're scheduling a new patient appointment. All right. So if you chose D, you are correct. You want to inform the patient of the appointment cancellation policy. So for those of you that are taking the CMAA, I know Susan's here. Susan, I know you are taking the CMAA. There was, I think, Latoya and Susan, you guys, I know, said you're taking the CMAA. So for those of you that are taking the CMAA, it does help to make sure you can actually explain the check-in process, right? Actually, the whole appointment, okay? If you can actually explain the process from making a patient appointment, the patient, reminding the patient of their appointment, checking the patient in, checking the patient out, and then going to the billing process. Make sure you know that process, because that whole process is going to help with questions like this, right? So, and if you know that process, then you know that one of the things you absolutely have to make sure a new patient knows is the cancellation policy, right? They need to know that if they no show, they will be charged, right? They need to know that they need to give us a 24-hour or 48-hour notice, right? Or yeah, the cancellation policy or late policy, or no showing, things like that. So this is going to help for those people. CMAA, like I said, know that entire process, and that way questions like this, which you will see on the test, will be a breeze. Okay, from making the appointment, first of all, make sure you know all the appointment types. From scheduling the appointment, know all the information you need to collect when scheduling. Know the information you need to collect when that new patient comes in, right? Know all the forms that you have to give that patient, right? And then the process with collecting payment for copay or whatever. And then like I said, the checkout process, and then submitting it. Okay. Jerkita says I'm going in and out. I'm sorry about that. Am I going in and out for anybody else? Sorry about that. So I hope you guys caught that, Susan and Latoya and anybody else that's taking a CMAA. Let me know if I'm okay. Thanks, Jerkita. Okay, Go to Nightmare says it's fine. Okay, you're welcome, Susan. Which of the following parts of Medicare covers both inpatient and outpatient services? Part A, B, C, or D? Yeah, definitely want to know these Medicare parts. Definitely on the administrative side. Um, the clinical medical assistants, you need to know it as well. You will see questions. Well, you may. It's definitely on a practice test. You definitely see it on a practice test. Whether your tests have it or not, I don't know, but because there's a possibility, you definitely want to know it. Administrative side, definitely, absolutely. Okay, Jarkita, someone says you may need to go out and come back in. You may need to rejoin. It is raining on my end. That's why I thought maybe I was having some issues, because let me look at this weather app. Yeah, it's actually about the storm. So let me get through this before I do have issues. Um, let's see. All right, so if you say C, that's correct. All right, so make sure you know this. Part A covers inpatient. Part B covers outpatient. C is both inpatient and outpatient, aka Medicare Advantage. Okay, if you didn't know that, make sure you make a note of that. And Part D is medications, prescriptions. Think of D for drugs. So A is in, B is out, C is both, and then D is drugs. Which of the following patient records should be filed last? I'm going to give you guys a moment to look at this. You need to know this whether you on the clinical or administrative side. You got to know how to file alphabetically. You need to know your numerical and terminal digit filing as well. All right, so if you chose A, that is correct. That is correct. You want to make sure if this is something you struggle with, you definitely want to make sure you are going back over your alphabetical filing lessons, okay? All right, which of the following actions should be taken during checkout? Verify insurance coverage, obtain the patient's demographic information, schedule a follow up, record and post payment adjustment. Again, on the administrative side, it helps to know step by step what to do from making the appointment to checking the patient out. Okay. When you know those steps, you can answer questions like this. Anybody else having connection problems? I see Vampy says they're having connection problems. Okay, I see mostly C. Someone says I'm between C and D, but leaning more towards C. Schedule a follow up appointment. Yep, this is why you need to know them steps. Record and post payment adjustment. That won't come until, well, that's actually not doing checkout, but that's something that you're doing maybe at the end of the day when you're posting payments and things like that. Okay. So that's not something you're doing when you're checking the patient out. But if the doctor needs to see the patient back, then yes, you do need to schedule up follow-up appointment. Verify insurance coverage, that's done prior to the appointment or when the patient comes in. Obtain the patient's demographic information, that's happening during check-in, right? Yeah, Jerkita, she said, are these questions related to what's on the CMA exam? Yes. So each test has a portion of administration on it as well. The difference is that this practice test that I'm going through now for the CMAA, this test is all administration, right? This is all administration. And then the CMA, RMA, and CCMA, those just have some administration, right? So yeah, it does. They definitely relate. They definitely relate. This just goes more in depth. So people that's taking administrative tests, they need to know everything administrative. Whereas, CMA, RMA, CCMA, you definitely didn't know appointment types. You need to know, of course, some insurance questions, ICD-9, CPT, things like that. I said ICD-9. I meant to say ICD-10. Sorry. Which of the following information can an MOA communicate to a patient when scheduling his or her procedure? The medical necessity of the procedure, the risks of the procedure, the alternative procedures that's available, or the pre procedure home instructions. Oh, Lisa said this is helpful. She's getting ready to learn about scheduling. Perfect. All right. So if you chose D, that's correct. Now let's look at these other options. All of these are outside of our scopes. The medical necessity, communicating that to a patient, that's the provider's job. We can't tell a patient why they need this procedure. The risk, that's the provider's job. The alternative procedures, we can't be recommending other procedures to the patient, right? It's very important to know your scope, right? Stay within your scope of practice. Anything outside of that, if you're advising a patient, you're acting without a license, and it is a criminal offense. When should an MOA obtain pre authorization for a patient's procedure? After the provider prescribes a procedure, after the patient schedules a procedure, after the patient pays the copayment, or after the insurance claim is submitted for the procedure. Artezima said, "Can you do a video on the drug doses and nutrition facts?" Artezima, dosage calculations. That's probably the most highly requested video I've seen lately for people requesting. I started working on some slides for that. It's going to come. I promise you guys, it's going to come. It's just I have a class that I'm teaching, and it's been a lot. It's more that goes into that than it is. It's easier for me to create these slides and go through them than it is for me to do that. But I'm going to try to get that done as soon as possible because I know people are asking about it. There's some videos I can recommend in the meantime. If you remind me, I can post it in the comments once this video actually posts. But I started it. I just haven't because I just want to make sure it's right. I don't want to just put up anything. I wanted the slides to look nice. I wanted to be engaging and because I know that's one of those topics that people are looking for, and so I just want to make sure it's right when I do it. So that's the only reason why I haven't done it yet. I started it, and I go back to it and work on it, and then I start doing something else for my job. So, all right. So yes, after the provider prescribes the procedure. Yep. So once the provider prescribes a procedure, aka orders the procedure. Sorry about that. Yes, obtain pre-authorization. Most of the time, they won't even schedule it until you get pre-authorization. So this wouldn't be correct. After the patient pays the copayment, what copayment? It hasn't been authorized or scheduled yet. After the insurance claim is submitted, what insurance claim? How is an insurance claim submitted if it hasn't been authorized, scheduled, right, or scheduled yet? All right, so those are things to think about. Which of the following is a component of OSHA's hazardous communication standard? So this is important, especially on the administrative side, CMAAs. Make sure you are familiar with OSHA standards, okay? Because you will see questions about, the standards like this one, the communication standard, the hazardous communication standard, right? So make sure you are familiarizing yourself with OSHA. Hey, Shawnette. She says, "Hello, my name is Shawnette. I live in Virginia. I'm getting ready to take my." Oh, right. I'm so nervous. There's so much. There is a lot to study, Shawnette. Make sure you have those study guides and practice sets if you don't already have them. If your school is not providing it, well, if you see what your school can do for you, yes, there definitely is a lot to study. Also, make sure you guys are looking up RMA videos as well. One thing I want to mention, I know I've had quite a few people to tell me they've used my videos to pass the CMA and RMA, But just always remember that my videos are only for CCMA and CMAA. And so I may not cover as much as the CMA and the RMA has on there. So just make sure you all are also reviewing that material as well. Quizlet is good. Other videos on YouTube as well. So D, ensuring that employee right to know information is available. So black and white, no, it would be yellow. What is it? Yellow and black tape if you had to put tape down to indicate a hazardous area. So this is wrong automatically. Having an office clean professionally once per week, that's not an OSHA standard, right? Even though that's probably the office standard, they want to have it clean professionally, right? That's not an OSHA standard. Hepatitis B vaccines is not an OSHA standard, right? It may be a requirement for that practice, but no, it's not an OSHA standard. But ensuring that employee right to know information is available, because employees, we do have a right to know, right? That is an OSHA standard. You're welcome, Chanette. I'm sorry, I accidentally went backwards. All right, when is it allowable to release a patient's medical record? When a court requests a record through a subpoena, when a patient is in an accident and an emergency requests a record, EMT, emergency medical technician, when a provider from another office requests to review the record, or when the patient's employer requests to transfer the record to workers' comp. Okay, I see A's coming in. Yep, subpoena. That out of the options listed, right? The only one that is allowable is when a court requests a record through a subpoena, right? Only other way is if the patient filled out a medical release form, right? Or authorization release form, right? EMT can't just come and ask for the record. Provider from another office, we can't, without written consent from the patient, an authorization form, we can't just send another provider information, right? When the patient's employer requests to transfer the record to workers' comp, that's not permissible. Now, if a patient, I will tell you, let me tell you this about workers' comp, okay? Now, this is impossible. An employee can't just call and, hey, I have an employee that works for you. Can we transfer that record to workers' comp? No, that cannot happen. But I will tell you this about workers' comp. If a patient has workers' comp, right? Their employer does have a right to their information, okay, because they're covering it. So that's the only time an employer has a right to the patient's information is if the patient has um, is being seen by workers' compensation, okay. And this is one of the reasons why um, I don't know if all practices do this, okay. I'm assuming so, but I can't speak for all practices. But I do know for a big practice that I work for, if a patient came in with for workers comp, we started a whole new record for them. Why? Because once workers comp pays for that visit, the employer has a right to that information. So because we didn't want that employer to have access to all of the patient's information, we started them a completely new record. So that way, the only information in that patient's record was related to the accident or injury that happened on the job. Okay. Which of the following suffixes means cutting into? Penia, ostomy, rhea, or otomy? Another one, another medical term one everybody needs to know this, whether you're on administrative or clinical side. You definitely want to know these suffixes, okay? And if you don't know these, make sure you write them down when we go through them in a second. Penia, ostomy, rhea, and otomy. All right, so if you chose otomy, you're correct. Now, a lot of people get ostomy and otomy mixed up. Now, what's the difference between otomy and ostomy? Otomy is cutting into or incision, right? Simply cutting into or incision. Ostomy is cutting into to create a hole or artificial opening. Okay, so make sure you make a note of that. Otomy is cutting into, also incision, right? Ostomy is cutting into to create a hole or artificial opening. Okay, so that's the difference between the two. Penia is deficiency or decreased or low, and then Rhea is discharge. Okay. Yes, Latoya, you bet. Latoya said, like the live people, 28 people watching and only 9 likes. Let's increase the likes to imagine and watching. Thank you, Latoya. I'm getting ready to make you a a moderator. You and Veronica, I'm gonna make y'all moderators, especially Veronica. She always on here. I said that last time, didn't I, Veronica? I got to figure out how to do it. Yes, guys, please like the live for me. Thank you. It's okay, Susan. She said her phone is slow. It's slow on my end too. All right, which of the following indicates a high concentration of fat in the blood? Hyperplasia, hyperlipidemia, hyperglycemia, and hypertension. And more terminology, more terminology, guys. And so when you're able to recognize um terminology, right? When you're able to recognize certain word parts, then it becomes a lot easier, because even if you don't know, let's just say you don't know what any of that means, however, you're able to recognize the root words, right? If you're able to recognize those root words, and you may say, you know what, I've never heard of this, but I know what that means, right? All right. Okay, Veronica, thank you. I'm going to figure it out before my next live. Hyperlipidemia, let's talk about that. So hyper, first of all, we know hyper is high, increased, right? Hyper means high or increased. Um, Plasia refers to growth of a tissue, or what is it? Yeah, growth of tissue, right? Um, Glycemia, that refers to sugar, right? Because glyco, GLYC/O, with the O attached, is what glycemia is sugar in the blood. And then hypertension, tension is pressure or blood pressure, right? So a high concentration of fat is lipidemia, because lipids refers to fats, also cholesterol as well. Okay. Jakita says, I've been studying the CMA app on my phone. Perfect, Jakita. Yes, I didn't even know they had an app. That's good to know. Which of the following actions should be taken first when processing mail? Sort, open, discard, or distribute? Golden Nightmare said, there's an app. I guess so. I didn't know that. Put details about it, Jakita. Is it just called CMA? Like, what color is it? Just so people know they're downloading the correct one. All right, let's see. Looks like everybody's choosing A. That's correct. If you look at these are actually listed in order: sort, open, discard, and distribute. So you want to sort the mail, right? Um, and this is definitely CMAA. You want to know the process for processing mail. You definitely need to know that. So sorting, meaning you're going through it, seeing what's what, trash, advertisement. Well, what let me not skip down to C. So sorted, see what's what, open what you're supposed to open. If it's a open what belongs to you, right? You want to discard what's trash, so advertisements and things like that, because you're going to get a lot of those people trying to sell you stuff. And then distribute, right? So distribute whatever belongs to the provider. You'll take put it on their desk or whoever, right? So this is actually the order here. Which of the following ensures patient rights? Informing patients that they own their medical records, advising patients of alternative procedures, providing patients with the option to see another provider, or notifying patients of procedures that are the least expensive. One of these we can already rule out because we just saw it in another question. Shawnette says their app for RMA. I don't know. I didn't even know there was a CMA app. Maybe look it up on, if you have an iPhone, maybe look in the App Store or Google Play Store. I had no idea. Veronica said, "App for which exam may I ask?" She said, somebody said above that they are using what a Jerkita. She says she's using a CMA app. All right, providing patients with the option to see another provider. Now, B, we should have been able to rule B out because we just saw it in another one, and we ruled that out because it says advising patients of alternative procedures. We'll never do that. That's never going to be an option for us, okay? It's outside of our scope. Informing patients that they own their medical records, that is incorrect. Why? Because patients do not own their medical records. The practice owns their medical records. Now, the patient, they have a right to the information in their records. Yes, that is their information. They have a right to copies of it. Okay. Make sure you know that patients have a right to copies of the information that's in their record. However, they do not own the medical record. The practice owns the medical record. And there may be a question that you may see on the test. Who owns the medical record, the physical medical record? Okay. Um, and then notifying patients of procedures that are least expensive. You know that we can't do that. That's one of those ones they throw in there. Some of these options make me laugh sometimes. Which of the following actions should an MOA take each time an established patient checks in? Ask them to complete a registration form, obtain verbal confirmation of demographic information, call a patient's insurance to determine continued coverage, or photocopy a patient's driver's license. Well, Monica said, yes, there's an app. Oh, for CNA, okay. All right. Obtain verbal confirmation. Yep, that was something I mentioned a little while ago. Every time a patient comes in, established patient means a patient have been seen before, right? Every time they come in, you want to have them verify or confirm that their information is still correct. What's their demographic information? The address, right? Phone number, employer, things like that. Make sure that information is still correct. Email, registration form, that's done for a new patient, okay? Verify insurance carrier to determine continued coverage. For certain insurances, you may have to do this definitely for like Medicaid. That's something that usually has to be um, determined, but not each time a patient comes in. And then photocopy the patient's driver's license. That's usually done for a new patient when they first come in. Which of the following is acceptable on a patient sign-in sheet? Date of birth, reason for visit, appointment time, or insurance carrier? All right, so sign in sheet. Sign in sheet should never reveal anything about the patient except their appointment time. It's bad enough the name is available. And this is actually called, and this, you want to write this down, incidental disclosure. Patient names even being on the sign in sheet is what's called an incidental disclosure. So if you see a question on the test that said which example Which of the following is an example of incidental disclosure? And you see an option for patient assigning sheet. That's because a sign-in sheet is disclosing a patient's name, but no information other than a name should be disclosed on a sign-in sheet. So date of birth, no. The reason for visit, absolutely not. Insurance carrier, no. But the appointment time, yes. Okay, so that's the only other thing that's acceptable. Okay, Veronica, thank you. So she said these are the apps that's available for download, guys. Make a note of that. NHA, CPT, CNA, as well as CMA. Thank you. I had no idea about that. Which of the following conditions is a provider testing for when he orders a UA for a patient who has an infection? A URI, UTI, UIP, or UGI? It's going to be another example of making sure you know what these other ones stand for once you know the correct answer. URI, UTI, UIP, or UGI. All right, if you said UTI, you are correct. Urinary tract infection. How do you know that? Because UA stands for urinalysis. Again, somebody mentioned earlier why it's so important to make sure you know those abbreviations. UA is the urinalysis, okay? URI, that's a upper respiratory infection. Okay, upper respiratory infection has nothing to do with a urinalysis, okay? UIP, that is the usual interstitial pneumonitis. Okay, so that has something to do with the lung, inflammation of the lung. And then UGI is upper gastrointestinal. So that's a test. Okay, that's a test that looks at the the stomach and the intestines. Okay, so it's the URI. Make sure you know that for upper respiratory infection. UIP is usual interstitial pneumonitis. And then UGI is upper gastrointestinal. It looks at the stomach area and the intestines, okay, and the esophagus. Failure to exercise treatment which causes patient harm. Fraud, negligence, abuse, or assault. Fraud, negligence, abuse, or assault. I want to point out something too about assault that I've realized by me having access to both the CMA and the I'm sorry, I'll talk about it in a second. I don't want to get anybody confused. Shawnette says, "Do you think I can use the CMA apps to study for the RMA certification?" Shawnette, I would never say yes, only because um, I even though all of the tests have some of the same information, I'm going to I'm going to give you a reason why I say no. Once we go through this correct answer, I'm going to give you a reason why I say no. Let me reveal this correct answer really quickly. I'm going to tell you why. So, of course, this is negligence, failure to exercise treatment, whether it's intentional or unintentional, it's negligence. Okay. Fraud, of course, is faking, faking codes or do, putting something in a chart that wasn't really done and stuff like that. Abuse is kind of self-explanatory. Now, Shawnette, this is why I say no. So assault, when you are taking the CCMA exam, they define assault as actual hitting and harming the patient, okay, a person, okay. CCMA defines assault as actually hitting or harming the patient, okay. The CMAA defines assault as an attempt or threat to harm a person, okay. The CCMA defines assault as actually hitting or physically harming a person. The CMAA defines assault as a threat or an attempt. Okay. Now, all of those definitions are correct. Even if you look it up online, all of the definitions are correct. But notice both tests, even though they're both given by NHA, define them differently. This is why I will always say, no, don't just focus on the CMA if you're studying for the RMA. Okay. Now, has it happened? Yes. Because, like I mentioned in the beginning, students have told me that they've used my CCMA videos to pass the RMA and CMA. So it's possible that it can happen, but I do not recommend it because sometimes words um, are defined differently, right? So on a CMAA, the definition for assault on a CMAA will be battery, because CMAA defines battery as the actual touching and harming the person. Okay. So that's just my input. And then the CMA and RMA has more information on it than the CCMA. All right. Now, the broadest of them all is the CMA. The CMA is considered like the cream of the crop of these certifications. I will be honest with you all. It's a 5-year certification, right? It's the longest certification, has the most questions. Yeah, no, wait a minute. The RMA actually has the most questions, but the CMA is considered like the cream of the crop, okay? Because it's the 5-year certification and the information on it is a lot more broader. So this is another reason why I would say if you're taking a CMA, study CMA information. If you're taking RMA, study RMA information, okay? And again, like I said, it happens when people study one of the other tests and they still pass. Because I will say this, in general, overall, like you do need to know the same information for all of it, right? So overall, you need to know terminology for all of them. You need to know OSHA, HIPAA, right? Um, some dosage calculations. You need to know, how to convert pounds to kilograms and all that good stuff, inches to feet and vice versa and all that good stuff. And you need to know, OSHA and clear and order draw and EKG placement and all that stuff. Yes, for all of them. So that is true that the pretty much the same type of information is on each test. I will say that. But when it comes to the administration part, there is more administration on the CMA and RMA than there is on the CCMA. So I hope that makes sense. I know that was a lot, but I just wanted to make sure I really honed in on that. Okay. Would I be able to use the app for CMAA? I don't know of an app for CMAA. That's a good question, April. I just learned of an app for CMA. I didn't even know that until now. So I'm not sure. Sharia says, what days and times do you go live? It varies, Sharia. I went live last Thursday. And then again tonight. I probably won't go live next week. If anything changes, I'll post it on YouTube before I go live. Like I usually post a day or two before, but I don't think I'm going to be able to go live next week because I have a lot to do. So it literally varies, Sharia, because I teach. My class is about to end next week, so I'll have more time before my next one begins for the fall. But it kind of varies. I just whenever I have free time, I'm like, I'm gonna go live this week. So it just depends. Shawnee says, thank you. I do agree. The RMA have a lot of administrative questions. Yeah, they're definitely more broader. All right, which of the following specialists should a patient be referred to for carcinoma? More terminology: endocrinologist, gastroenterologist, pulmonologist, and an oncologist. This is why it's so important to be able to recognize terminology, right? Carcinoma. Most of the time, with most words, a lot of times the suffix is going to be a dead giveaway for certain things, right? Because a lot of times the suffix is going to tell you whether something is a procedure or a condition or stuff, something like that, right? But in this instant, because we're trying to figure out what specialist this person is going to, most likely we probably got to look at the root word, because the root word is going to relate to something, is going to relate to what's special. And it kind of, then again, it kind of varies, because even in some instances, like the suffix may tell us what specialist we need to go to. So it kind of varies. This is why it's just so important for medical terminology. Like I told my students that I have right now, medical terminology is going to be your foundation. That is where you start. That is when you know medical terminology, that's going to get you through some of those questions that you're going to see And some things you're going to be like, I've never heard of this condition. But guess what? I recognize that root word, right? I recognize that root. I know what body part is talking about. I know what organs it's talking about. So I can answer this question. This is why terminology, whether you're taking a CMA, RMA, CCMA, or CMAA, you definitely want to make sure you can recognize certain things. Susan said, "Is there chapter 5 for CMAA?" No, this is what is this? Is this part 4 of CMAA? I'll eventually do a part 5, Susan. Um, RMA has 75 questions for administrative. Thank you, Veronica. Okay. For administrative, yeah. Okay. Let's see. So endocrinologist, gastro, pulmonologist. The answer is oncologist. Why? Carcino refers to cancer, right? Oma is tumor, but what told us what specialist we need to go to? It's the carcino, because carcino refers to cancerous. Okay. Endocrinologist, that's dealing with like hormones. Diabetic patients go to endocrinologists. Now, gastroenterologist, gastro is stomach, right? Entero is small intestines. Pulmono is lungs, right? So onco is cancer. Even if, let's say, you never knew that onco was cancer, if you knew that these basic body parts right here was lung and stomach and small intestine, you can automatically rule those out. So some questions, and that's why I mentioned in the tips to use process of elimination, because there's going to be some instances where you're going to be eliminating things that you absolutely know that the answer is not. Okay. Well, all of it is important, but this is another one that you need to know for um, any test you're taking. The following, which of the following should be obtained prior to checking patient's blood pressure? Implied consent, authorization form, informed consent, certification form. This is important across the board. You got to know the differences between these consents. Two answers we already can kind of rule out. Okay, thanks. By taking NHA practice, would they help pass the exam? I'm due. Okay, yes, Sharia. So which test are you taking? Are you taking the CMAA or are you taking the CCMA? Either way, yes, the practice tests are going to help you pass the exam. But just make sure when you're taking those practice tests, don't get stuck on the actual questions. Just make sure you're studying the information, right? So for an example, as we're going through these tests, I'm also telling you what the wrong answers mean as well, just in case you see those on a test. So when you're going through your practice test, make sure you also know what those wrong answers mean as well, just in case you see that. Okay. And so that's the biggest thing. People, they go in and they look for the exact questions and they get disappointed. Make sure you know the content. Okay. That's the biggest thing. Okay. CCMA. Yep. Make sure you know. So CCMA, terminology, as I mentioned, those foundational things, those is calculations, conversions. Make sure you can convert, order, draw, EKG placements, HIPAA, OSHA. I mean, everything. What else? The quadrants. Make sure you know what organs are in which quadrant. You know all of that. Appointment types. She said I read them all. Yes, go through it all. All right, let's talk about this consent. Implied consent. People always get implied consent and informed consent mixed up. Implied consent. What does it mean to imply something? When you imply something, you suggest it, right? That means you didn't really say anything. You implied, you suggested based on your actions, right? So when a patient gives you their arm so you can check their blood pressure or their arm so you can draw their blood, that means that they are suggesting that it is okay. Informed consent means that they are actually signing a consent form. Okay, that is when the patient is having some kind of procedure and they need to sign that they understand the risk and benefits of that procedure. Now, authorization form and certification form, we could automatically rule those out because authorization form, a patient doesn't need authorization form to check their blood pressure. Certification form, but they do have to give some type of consent. So you should have been able to rule out B and D automatically, and then it should have come down to A and C, and then you think about it. Okay, well, I know it's not B and D. Informed versus implied. Implied means to suggest. Informed is actually signing. Another example of implied consent, which you need to know, is if when a patient is, let's say, in cardiac arrest or unresponsive, okay, them being that patient or that victim being unresponsive implies that they want your help. So you are able to go ahead and perform CPR on them and other life saving measures. Okay. That is another example of implied consent. Um, Vampy says informed consents can also be expressed. That is correct. Informed consent is a type of express consent. Okay. So when we talk about express consent, think about what it means to express something. That means to make it known, whether it's a verbal consent. And again, if it's a verbal or express consent, it's still not implied consent, because implied consent means you are not saying anything. Your actions is given consent. Okay. So express consent, yes. Examples of express consent is informed consent or verbal consent. Okay. Sharia said those are hard calculations. Okay, so yeah. So the biggest thing for the calculation, Sharia, you want to make sure you know converting pounds to kilograms and vice versa, inches to feet and vice versa, inches to centimeters and vice versa. How many milliliters are in a tablespoon and a teaspoon? Make sure you know that. What else? However much the doctor um, um, wants, you're going to divide that into how much you have. So if the provider wants 500 milligrams of, well, no, if the provider wants yeah, let's say 500 milligrams of, no, because we don't, they don't come in. So let's say the patient, the provider wants 250 milligrams of Tylenol. You only have a 500 milligrams, so you would divide what the doctor wants by what you have on hand. Okay, so what the doctor wants by what you have on hand. Okay. All righty. So don't forget to like this video, guys, and subscribe and share it. All right. And any questions, I'll take a few minutes to answer some questions before I log out. I do have one-on-one sessions available now, and I mentioned that they were highly requested, so I started making myself available. So those are in the comments. I'm sorry, in the description. If anybody wants to schedule one for exam, you want to talk more about the test. I had somebody scheduled just because they needed somebody to talk to personally. Somebody wanted me to go over their resume with them and cover letter. So, those are available. 30 minutes. Any questions? I will take a couple minutes to answer questions. But yeah, Sheree, those are the biggest things you want to make sure you know. Quizlet is a good resource too. Only thing about Quizlet, you guys got to be careful, is that these are people putting that stuff up there, so it could be wrong. So just be mindful of that. So double check some of those answers. I went the one-on-one I did last week. She had got a lot of her answers from there, and so we kind of went through some of those questions she had on Quizlet. And so just be careful with those. Any questions? Any questions? I'll just give it a couple more moments before I end it. You're welcome. You're welcome, Latoya and Golden Nightmare. There's a link in my there's a link. Let me see. It should be in the description box here. Yeah, so there's a link in the description box. If you just have a question, you can always just email me. Like, you don't have to book the one-on-one. That I made those available for because people were asking, and they were offering to pay me for my time. And I was getting on the phone with people and I couldn't keep doing it. So I went on ahead and created a one-on-one session. But if you have like a question, you can just email me You don't necessarily have to book that one-on-one. That's just an option. So if you want to just email me first and ask me a question, that's fine. And then if you do want the one-on-one, the link is in the description of the video. Um, Let me just kind of update that because I don't know. Let me see. I think the next one I have is next Monday. Let's see. Any questions? You're welcome, April. You're welcome, Ash. Stephanie, you're welcome. Susan, yep, you're welcome. Okay. Alrighty. So it doesn't look like anybody have any questions, Vampy. All right, guys. So I'm gonna go ahead and get out of here. Like I said, you can always email me, khearts, what is it? kheartcpr@gmail.com. Okay, she says 65 learner. Oh, yeah, Sharia. Okay, I see exactly what you mean. Okay. Yeah, I do. I have some students who are in that same age range. So yes, I definitely understand. So, if you wanna email me if you want to book a one-on-one session with me, that's fine. The link is in the description box. Susan, the times are between, let me see. It's I forgot what days I made available myself. Hold on. Mondays, Wednesdays, and Fridays. Mondays between 8 to 9, Wednesdays 9 to 10, and then Fridays 6 to 8. This Friday and next Friday I won't be available. So it looks like the next one I'll be available is on Monday or Tuesday. I'm sorry, Monday or Wednesday. I'll put my email in the link again. Okay. I'll put it. Thank you for the reminder, Veronica, at gmail.com. Okay. All right. I just don't want to miss any questions. So yeah, guys. So just make sure again, okay, Veronica says her exam is on the 15th, but she's many who also wrote these exams. Okay, got you. Okay, also membership. Okay, got you. Okay, she know the differences. Okay, all right, Joanna, you're welcome. I just want to go through and make sure I don't miss anything. What was her name? Zerzima. Oh my goodness, what was her name from earlier? Are you still on here? What's her name? Oh my goodness, in the beginning. I told her I would come back to her at the end. Oh my goodness. Let me go back and see. Oh, Artezima. Artemisa. Are you still on here, Artemisa? Good night, Veronica. Thank you for always being on here. Veronica has been on here since day one, every single time. Are you still on here, Artezima? Oh, Shawnette, somebody said please post your email in the link. Alrighty. Oh, okay. She said we have. Oh, what time zone are you on? So that will be, those time zone are Eastern Standard Time for me. So the 8 to 9 is Eastern Standard Time. Not sure what time zone you're in, Sharia. They're PM. Memphis. Oh, so what is that? We might be on the same. If we're not the same time zone, it's probably just an hour. If anything, it's probably an hour. Are you on Central? I'm in DC, by the way, Sharia. So I'm Eastern. Are you on Central? And Sharia, when you go on there and book it, it'll show you in your time zone anyway. So even if we are on different time zones, it'll show you your time. Okay, you're Central. Okay, that's fine. So that means, so 8 o'clock for me would be 7 o'clock for you. So when you go on there, the times will be available in your own time zone. Los Angeles is PST. That's Pacific. As a matter of fact, the person I did a one-on-one with last week, she was Los Angeles. She was on Pacific as well. You're welcome, Sharia. So yes, Susan, you're Pacific, so you would just same thing. It would show up in your time zone. So for an example, I got on with her at 7 p.m. It was 4 p.m. for her. So all right, guys, I'm going to go ahead and end this. I did put my email there. So, guys, just feel free to send me an email if you have a question. And as always, I'll check them and respond. I respond to all of my emails. Sometimes it takes me a few days because I get a lot of them on this channel, but I do eventually respond to all of them. So, you can email me or you can book a one on one. All right, guys, you have a good night. I'm going to go ahead and end this.